If you've been told that type 2 diabetes is permanent, that your blood sugar will never come down without pills, or that reversing insulin resistance naturally is impossible, then what you're about to hear may feel like a breakthrough. Because for the first time, you're going to learn exactly which foods have been scientifically proven to not only lower blood sugar fast after eating, but also protect your nerves, heal your metabolism, reduce A1C levels, and potentially reverse diabetes completely. And at the end of this video, I'm going to share something few people ever find out, a daily habit that amplifies the effect of these foods and works even if your blood sugar has been out of control for years. So stay with me until the end, because the truth could change everything. Most people living with type 2 diabetes or prediabetes feel like they're constantly chasing their glucose numbers. One meal too high in carbs, and suddenly your blood sugar spikes, your energy crashes, and the cycle of insulin resistance continues. But what if the solution wasn't to eliminate everything from your diet, but instead to focus on just a few of the right foods? The best foods for diabetics to eat, the ones that science shows actually lower blood sugar levels, stabilize insulin response, and support long-term diabetes management. The problem is that there's so much confusion online about what diabetics can and cannot eat. Some say eggs are bad, others say they're a superfood. Some say fat is dangerous, others say it heals. And the truth is, it all depends on the food's effect on your blood sugar, your insulin sensitivity, and your metabolic response. That's why in this video, we're cutting through the noise and giving you what actually works, backed by studies, not fads. Let's start with a food that most people never expect to see on a diabetic-friendly list: eggs. For decades, eggs were wrongly blamed for raising cholesterol and increasing heart disease risk. But newer studies have revealed the opposite, especially for people with type 2 diabetes. Eggs contain all 9 essential amino acids, which help repair muscle tissue, support healthy metabolism, and increase satiety. They're also one of the best foods for stabilizing blood sugar in the morning, especially when compared to high-carb breakfasts. In fact, eating eggs regularly has been linked to improved insulin sensitivity and a reduction in fasting blood sugar over time. But eggs do more than just lower glucose levels. They're also rich in choline, a nutrient that improves liver function and reduces fatty liver, a condition that many people with diabetes have without realizing it. Eggs also contain lutein and zeaxanthin, 2 powerful antioxidants that protect the retina from damage and help prevent diabetic retinopathy, one of the leading causes of blindness in diabetics. And for nerve health, they're one of the most complete foods you can eat, thanks to their high vitamin B content and anti-inflammatory properties. The way you prepare eggs matters. Scrambled with spinach and avocado adds fiber and magnesium, which further improves glucose control. Boiled eggs paired with fermented vegetables support gut health, which indirectly lowers blood sugar and inflammation. And an omelet with turmeric, onions, and peppers delivers a powerful dose of anti-inflammatory compounds that can reduce oxidative stress in the body, one of the main drivers of diabetic complications. Another reason eggs are among the best foods to lower blood sugar is because they reduce post-meal glucose spikes. When you eat carbohydrates alone, your blood sugar rises quickly. But when you combine them with a protein and fat-rich food like eggs, the absorption of glucose slows down, leading to a more stable insulin response. That's why a breakfast with eggs, rather than cereal or toast, can dramatically reduce your blood sugar curve throughout the day. For people trying to lose weight with diabetes, eggs are also a powerful ally. Their high protein content increases satiety, reduces cravings, and supports lean muscle mass, all of which are crucial for maintaining a healthy metabolism and reversing insulin resistance. And unlike processed meats or sugary breakfast bars, eggs do all of this without increasing your A1C levels or harming your kidneys. Speaking of kidneys, it's worth noting that not all protein is created equal. Red meat and processed protein sources can put strain on the kidneys, especially in people with diabetes. But eggs provide bioavailable protein that your body can absorb and use efficiently, without excess waste products that damage the kidneys. That makes eggs not just a great food for diabetics, but one of the safest protein sources available for long-term health. Beyond the physical benefits, eggs also impact mood, anxiety, and cognitive performance. This matters because diabetes is linked to depression, brain fog, and poor stress tolerance. The vitamin D, omega-3s, and choline found in eggs support neurotransmitter function, stabilize mood, and improve resilience to daily stress. People with diabetes who include eggs in their diet often report better focus, more energy, and a more stable emotional state, which in turn makes it easier to stay consistent with a healthy eating plan. Let's not forget the hormonal benefits. For men, eggs support testosterone production, which helps with libido, energy, and muscle strength. For women, eggs help regulate ovulation and hormone balance, especially important for women with PCOS or insulin-related fertility issues. In short, eggs are more than just a food. They're a multifunctional, metabolic powerhouse that touches nearly every system affected by type 2 diabetes. Of course, quality matters. The best types of eggs are pasture-raised or omega-3 enriched, as these contain higher levels of anti-inflammatory fats and key micronutrients. Conventional eggs can still be beneficial, but when possible, choose the highest quality you can find. The recommended portion for most people is 2 to 3 whole eggs per day, ideally paired with fiber-rich vegetables or low glycemic ingredients. Now, you may be wondering, how can just one food make such a difference in blood sugar control? The answer lies in how food interacts with your body at a hormonal, cellular, and metabolic level. When you eat foods that support your insulin receptors, reduce inflammation, and fuel your mitochondria, you're not just treating symptoms, you're addressing the root cause of diabetes itself. And that's exactly what this video is about, giving you real tools to improve your blood sugar, lower your A1C, and feel in control again. So if you've ever searched for the best foods to lower blood sugar, the top foods for diabetics, or what to eat to reverse type 2 diabetes naturally, keep watching, because the next food we'll cover might surprise you even more. It's one of the most misunderstood superfoods out there, and it's changing the lives of diabetics all over the world. The next food on our list is one that most people know is healthy, but very few realize just how powerful it is for reversing insulin resistance and stabilizing blood sugar. I'm talking about nuts. Whether it's almonds, walnuts, pistachios, or macadamia nuts, these tiny foods are among the best-kept secrets in diabetes nutrition, and the research is overwhelming. One of the biggest challenges for diabetics is managing blood sugar spikes after meals. Nuts are rich in healthy fats, protein, fiber, and antioxidants, which together slow digestion, blunt the glucose response, and reduce the insulin demand on your body. This makes them one of the best foods to eat between meals or even as part of a balanced diabetic-friendly breakfast. In fact, studies show that when nuts are consumed alongside carbohydrates, the blood sugar impact is significantly lower compared to eating the carbs alone. But it doesn't stop there. Nuts are also loaded with magnesium, a mineral that over 80% of diabetics are deficient in. Magnesium plays a key role in insulin signaling and glucose metabolism, and low levels are directly linked to higher A1C, increased insulin resistance, and even diabetic nerve pain. Eating just a handful of magnesium-rich nuts like almonds or cashews daily can lead to measurable improvements in blood sugar regulation and nerve function. Nuts are also a game-changer for inflammation. Chronic inflammation is at the heart of almost every diabetic complication, from neuropathy and kidney disease to retinopathy and cardiovascular problems. The polyphenols, omega-3s, and vitamin E found in nuts act as powerful anti-inflammatory agents that calm the immune system and protect your cells from damage. That's why people who eat nuts regularly have lower markers of inflammation, including C-reactive protein and interleukin-6. Let's talk about nerve health, because this is something many people don't address until the damage is already done. Diabetic neuropathy affects nearly half of all people with diabetes at some point in their lives. It causes burning, tingling, numbness, and pain in the hands and feet. But what most don't realize is that the food you eat can either accelerate or slow that damage. Nuts contain alpha-lipoic acid, B vitamins, and healthy fats that support nerve repair, improve conductivity, and reduce the painful symptoms of diabetic neuropathy. And the benefits don't stop at the physical. Nuts have also been shown to improve mood, lower anxiety, and support better brain function. This is especially important for diabetics, who often experience increased stress, poor sleep, and emotional fatigue due to blood sugar fluctuations. Nutrients like tryptophan, vitamin B6, selenium, and omega-3s found in nuts help stabilize neurotransmitter levels and improve serotonin production, leading to greater emotional balance and resilience. One of the myths about nuts is that they're too high in calories or fat for people with diabetes. But this couldn't be further from the truth. Studies consistently show that people who eat nuts daily are actually leaner, have less abdominal fat, and lower insulin resistance than those who avoid them. This is because nuts reduce cravings, stabilize blood sugar, and provide long-lasting energy without the roller coaster of sugar highs and crashes. Weight control is a critical factor in reversing type 2 diabetes and managing prediabetes. Nuts support this by increasing satiety, improving metabolism, and promoting fat oxidation. When you replace processed snacks or refined carbs with a small portion of raw or lightly roasted nuts, you're not just improving your diet, you're making a metabolic shift toward healing. For heart health, nuts are one of the most protective foods you can consume. Diabetics are at much higher risk of heart attack and stroke due to endothelial damage, high blood pressure, and poor lipid profiles. But regular nut consumption improves HDL, good cholesterol, lowers LDL, bad cholesterol, and reduces triglycerides. Nuts also contain L-arginine, which increases nitric oxide production in the blood vessels, relaxing arteries and improving circulation. If you've been dealing with high blood pressure or poor circulation, especially in the legs or extremities, nuts should absolutely be part of your daily diabetic meal plan. They help reverse the root causes of vascular dysfunction by nourishing your blood vessels and reducing oxidative stress. And for anyone struggling with hormone imbalances, whether it's low testosterone in men or irregular cycles and PCOS in women, nuts provide a rich source of zinc, selenium, and healthy fats that support endocrine function. For men, this means better libido, energy, and fertility. For women, it can mean more regular cycles, better ovulation, and a reduction in symptoms related to insulin resistance. One of the most powerful combinations in diabetic nutrition is pairing nuts with other low glycemic, high-fiber foods. For example, adding walnuts to a spinach salad with olive oil and vinegar can significantly improve the glycemic response of the entire meal. A Greek yogurt parfait with pistachios, cinnamon, and berries can serve as a blood sugar stabilizing breakfast or snack. And a small serving of almond butter on flaxseed crackers can offer sustained energy and hunger control with almost no spike in glucose. The best types of nuts for diabetes include almonds, walnuts, pistachios, macadamia nuts, and pecans. These varieties have the best combination of fats, micronutrients, and low glycemic impact. The ideal serving size is around 30 to 50 grams per day, roughly a small handful. And whenever possible, choose unsalted, raw, or dry roasted varieties to avoid added sodium or inflammatory oils. Some people worry about potassium levels or kidney strain with high nut intake, especially those with advanced kidney disease. If that's your situation, it's wise to monitor portion size and consult with your healthcare provider. But for the majority of people with diabetes, moderate nut consumption offers powerful protective effects without significant risk. It's easy to underestimate the power of something so small. But in the case of nuts, small packages deliver massive results. They stabilize blood sugar, support nerve and heart health, reduce inflammation, and help regulate body weight, all key components in reversing type 2 diabetes naturally. In a world full of complicated diets and conflicting advice, sometimes the best answers are the simplest ones. And when it comes to diabetic-friendly foods that work with your body instead of against it, nuts are one of the most powerful tools you can choose. And believe it or not, the next food we'll talk about is even more nutrient-dense than nuts. It requires no cooking, is easy to add to almost any meal, and offers some of the most profound benefits for people trying to control blood sugar naturally. It's a food group most people overlook, but after this, you'll never see it the same way again. The third food on our list might be the most underrated weapon in the fight against high blood sugar. It's often ignored in favor of trendier options, but when it comes to stabilizing glucose, supporting hormone balance, improving digestion, and reversing insulin resistance, few things come close. I'm talking about seeds, specifically, nutrient-dense superseeds like chia, flax, pumpkin, sesame, and hemp. These tiny powerhouses are packed with fiber, plant-based omega-3s, antioxidants, minerals, and protein, all of which are essential for anyone dealing with type 2 diabetes or prediabetes. Let's start with one of the biggest challenges diabetics face: post-meal blood sugar spikes. Seeds are rich in soluble fiber, which forms a gel-like substance in the gut. This slows the digestion of carbohydrates, reduces the speed of glucose absorption into the bloodstream, and prevents sharp increases in blood sugar after meals. In other words, seeds help flatten the glucose curve, something every diabetic should be aiming for. If you've ever felt that blood sugar rollercoaster after eating a high-carb meal, adding seeds to your diet can change that completely. But seeds do more than just slow digestion. They also feed your gut microbiome, the trillions of beneficial bacteria in your digestive system that play a massive role in blood sugar regulation, inflammation, and even mood. The prebiotic fiber found in seeds like flax and chia helps increase short-chain fatty acid production, which improves insulin sensitivity and reduces inflammatory markers throughout the body. This makes seeds a perfect fit for any diabetic-friendly meal plan. One of the most powerful ways seeds help lower blood sugar fast is through their high magnesium content. Magnesium is essential for glucose transport into cells, insulin receptor sensitivity, and cellular energy production. A deficiency in magnesium is extremely common in people with insulin resistance and is strongly correlated with elevated A1C levels. Adding pumpkin seeds, sesame seeds, or hemp seeds to your meals is one of the easiest ways to restore magnesium levels and improve metabolic function without supplements. Seeds are also incredibly effective for managing inflammation, which is at the root of most diabetic complications, especially neuropathy, joint pain, and vascular damage. Alpha-linolenic acid, a plant-based omega-3 found in flax and chia seeds, reduces C-reactive protein and other pro-inflammatory markers, while zinc and selenium in pumpkin and sesame seeds enhance antioxidant defenses. This reduces oxidative stress and protects your nerves, blood vessels, and organs from long-term damage caused by chronically high blood sugar. Let's talk about hormone health, because diabetes doesn't just affect glucose, it throws your entire endocrine system out of balance. Seeds are rich in key nutrients like zinc, vitamin E, magnesium, and omega-3s that support hormone production, reproductive health, and adrenal function. For men, zinc-rich seeds improve testosterone levels naturally, which enhances libido, energy, and muscle mass. For women, seed-based diets have been shown to regulate estrogen and progesterone, support ovulation, and reduce the symptoms of PCOS, a condition closely tied to insulin resistance. And when it comes to nerve health, seeds are uniquely powerful. The combination of magnesium, vitamin B6, and antioxidant compounds found in these foods helps protect nerve tissue, improve neurotransmitter signaling, and reduce the severity of diabetic neuropathy. Studies have shown that diabetics who consume at least 20 to 30 grams of seeds daily experience significant improvements in nerve conduction and a measurable reduction in pain, tingling, and numbness in the hands and feet. Heart health is another area where seeds shine. People with diabetes are at elevated risk of stroke, heart attack, and arterial plaque buildup. But seeds contain phytosterols, lignans, and anti-inflammatory fatty acids that improve lipid profiles, lower LDL cholesterol, and reduce blood pressure. The arginine in seeds increases nitric oxide production, which relaxes blood vessels and improves circulation. This makes seeds one of the best foods for diabetics to lower blood sugar and support cardiovascular health at the same time. Many people worry that seeds will make them gain weight because of their fat content. But the truth is, seeds support healthy weight loss and metabolic balance. The combination of fiber, protein, and healthy fat increases satiety, reduces cravings, and improves blood sugar control between meals. When you eat foods that keep you full and stable, you're much less likely to snack on processed carbs or sugar, both of which spike insulin and promote fat storage. Let's look at some of the best seeds for people with diabetes. Chia seeds are an excellent source of fiber and omega-3s. Flax seeds provide lignans and estrogen balancing compounds. Pumpkin seeds are high in magnesium, zinc, and antioxidants. Sesame seeds are rich in calcium and B vitamins. And hemp seeds deliver complete plant-based protein along with anti-inflammatory fats. Each of these can be easily added to meals, smoothies, salads, or yogurt, creating a powerful synergy of nutrients that directly improves insulin function and blood sugar stability. Portion size matters. The ideal daily amount is about 20 to 30 grams of seeds, roughly 2 tablespoons. This is enough to deliver therapeutic benefits without excessive calories. Soaking or grinding your seeds before eating can also enhance absorption. For example, ground flax seeds are better digested than whole ones, and soaking chia seeds improves their texture and bioavailability. There are endless ways to incorporate seeds into your diabetic diet. You can start your day with chia seed pudding topped with berries and a sprinkle of cinnamon. You can add ground flax seeds to oatmeal, smoothies, or even meatballs. Roasted pumpkin seeds make a great afternoon snack or salad topping. Hemp seeds can be sprinkled over steamed vegetables or blended into protein shakes. And sesame seeds can be used in dressings, tahini, or even crusted onto baked fish. If you're trying to find the best foods for diabetics to lower blood sugar quickly and consistently, seeds should be at the top of your list. They're easy to store, require no refrigeration, and offer some of the most concentrated nutrition per gram of any food on earth. For people with prediabetes, type 2 diabetes, or anyone trying to improve their metabolic health, seeds offer a simple, affordable, and highly effective tool for healing. One of the most powerful things about seeds is that they work synergistically with the other foods we've already covered. When combined with eggs and nuts, seeds complete the metabolic trifecta, providing fiber, fat, protein, and micronutrients in a form your body can use to stabilize blood sugar, regenerate nerves, reduce inflammation, and support overall healing. Now, if you've made it this far, you already know more than 90% of people living with diabetes. But here's the key. None of this works unless you're consistent. The results come when these foods are part of your everyday life, not as occasional additions, but as staples in your routine. And if you stick with it, you'll likely find that your blood sugar improves, your energy increases, your cravings decrease, and your A1C starts to move in the right direction, naturally, safely, and without the side effects of medication. Coming up in the final section, I'll share the most overlooked strategy to make all of this even more effective, a simple habit that enhances nutrient absorption, boosts insulin sensitivity, and can accelerate your results in just a few days. So far, we've talked about 3 incredibly powerful foods that every diabetic should include in their daily routine: eggs, nuts, and seeds. Each of these plays a unique role in stabilizing blood sugar, improving insulin sensitivity, supporting nerve and heart health, and reversing the metabolic chaos that defines type 2 diabetes. But now it's time to tie it all together and reveal one strategy that can multiply the effects of everything you've learned. That strategy is nutrient timing and food combination. It sounds simple, but it's one of the most powerful tools to control blood sugar naturally, especially for people with insulin resistance or elevated A1C levels. You see, the way you combine and sequence foods at each meal can completely change how your body responds to glucose. It can mean the difference between a massive blood sugar spike and a slow, steady curve that keeps you energized and in control. The secret lies in eating foods in the right order. When you start your meal with fiber, protein, and fat, like seeds, nuts, or eggs, and then move on to any carbohydrates, your blood sugar response is drastically reduced. Studies show that eating protein and fiber first can lower post-meal glucose spikes by up to 30 to 50%. That's huge. And it works even if you're eating the exact same foods, just in a different order. Let's say you're having a diabetic-friendly meal that includes grilled chicken, roasted vegetables, and a small portion of brown rice. If you start with the rice, your blood sugar will rise quickly. But if you begin with the vegetables and protein first, then finish with the rice, your glucose levels stay much more stable. This is because the fiber and protein slow down gastric emptying and reduce the glycemic impact of the carbs that follow. The same applies to breakfast. Starting the day with eggs and a handful of walnuts, then following up with low glycemic fruits like berries, will produce a much better blood sugar curve than beginning with toast or juice. This strategy isn't about eliminating foods, it's about upgrading the way you eat them. When you pair the best foods for diabetics with smart nutrient timing and combinations, your meals become medicine. You're not just managing diabetes, you're actively reversing it with every bite. But there's one more piece to the puzzle. Movement. Even light physical activity after a meal, like a 10-minute walk, can dramatically improve glucose clearance from the bloodstream. Walking activates your muscles, which start absorbing glucose without needing insulin. This simple habit has been shown to lower post-meal blood sugar by up to 40%. So imagine this. You eat a meal rich in eggs, nuts, and seeds, you follow proper food sequencing, and then you go for a walk. That's how you create a metabolic environment where blood sugar drops naturally, safely, and sustainably. This is where true transformation begins. Not in crash diets or medications with side effects, but in understanding your body and giving it the nutrients, patterns, and signals it needs to heal. The best foods for diabetics aren't just about avoiding sugar, they're about rebuilding your metabolism from the inside out. And the truth is, you don't have to be perfect. You don't have to follow a rigid diabetic diet or avoid every carb forever. What you do need is consistency. Making better choices most of the time. Including the right foods daily. Understanding the science behind your meals. That's how you lower your blood sugar naturally. That's how you reduce your A1C. And that's how you reverse insulin resistance over time, without starving, without guessing, and without fear. If you're still watching, it means you're serious about changing your life. And I want to reward that by telling you this. You're not broken. Your body wants to heal. And when you give it the right foods, in the right way, at the right time, it will. I've seen people go from dangerously high blood sugar to complete remission. I've seen A1C drop from 9.2 to 5.7 in under 90 days. I've seen people get off their meds, feel energized, sleep better, and live with freedom again. And it all started with simple changes, like the ones you just learned. So now, it's your turn. If you found this video helpful, the next step is simple. Click the link in the description below to discover how thousands are reversing type 2 diabetes naturally, without pills, without extreme diets, and without confusion. Like this video to let YouTube know it brought you value. Comment below and tell me which of these foods you're already eating, or which one you're excited to try first. I read every single comment. And subscribe for weekly videos that help you lower blood sugar, reverse insulin resistance, and take back control, naturally, safely, and with real science. Before we go, here's the disclaimer I always include, just to be crystal clear. The content in this video is for informational purposes only. It's not medical advice, it's not a substitute for professional diagnosis or treatment, and it's not intended to replace your doctor's guidance. Always consult with your healthcare provider before making any changes to your diet, medication, or lifestyle. I'm not a medical professional, just someone committed to sharing science-backed information to help you make better choices. You are responsible for your own health decisions, and that's exactly how it should be. Thanks for watching. I'll see you in the next one.